The system of care serves anyone with or at risk for a serious emotional disorder from birth to 21 years old and their families. The mission of the System of Care St. Louis region is to seamlessly integrate social and emotional wellness services and practices into all aspects of the care system and to ensure understanding of and access to holistic care, services, resources, and support for children, youth, and their families. For more information, please visit www.systemofcarestl.org. Support is all around you.
Hello, my name is Diane Faust. I am with the Department of Mental Health, Division of Developmental Disabilities. I am the Intake Assessment Supervisor in the St. Louis area. Locally, the division is referred to as Regional Office. There are 11 regional offices and satellite offices in the state. The St. Louis Regional Office covers the 4 counties area of St. Louis City, St. Louis County, St. Charles County, and Jefferson County. The Department of Mental Health's vision is Missourians shall be free to live their lives and pursue their dreams beyond the limitations of mental illness, developmental disabilities, and alcohol or other drug abuse. The mission of the Department of Mental Health, working side by side with individuals, families, agencies, diverse communities, the Department of Mental Health establishes philosophy, policies, standards, and quality outcomes for prevention, education, habitation, rehabilitation, and treatment for Missourians challenged by mental illness, substance abuse, addiction, and developmental disabilities. A developmental disability is a disability that is attributed to cerebral palsy, epilepsy, and intellectual disability, head injury, autism, or a brain dysfunction, the physical or cognitive limitations that exist due to the disability interferes with the individual's ability to function in life activities such as self-care, communication, learning, self-direction, mobility, and a capacity for independent living. Eligibility is determined by a review of records to locate evidence of a mental or physical impairment related to an intellectual or developmental disability that occurred prior to the age of 22 or prior to the age of 18 for an intellectual disability, is ongoing, to be lifelong, requires rehabilitation services, and substantially impacts the individual's life in at least 2 of the 6 basic life areas. The impact on the individual's life is measured by a functional assessment as opposed to linking eligibility to a specific diagnosis. Each individual is evaluated to provide information about the individual's functioning, strengths, and needs related to his or her disability. Eligibility is determined through the intake process, which can take 30 working days and an additional 30 calendar days in order to gather proof of a developmental disability and complete an adaptive behavior assessment in a face-to-face meeting. Eligible individuals are assisted in obtaining services with available resources of the community and/or the division. Eligible individuals with Medicaid are assigned to a support coordinator who helps develop individual support plans and monitor the individual's supports and progress toward identified goals. Eligible individuals without Medicaid are assigned to the Information Coordination Program. They have access to the community services and resources by contacting an information specialist. Ineligible individuals have the right to appeal the decision. They are also given information about the community resources that may be appropriate for this situation. Additional information can be found on the department website www.dmh.mo.gov. Then click on the Division of Developmental Disabilities. In St. Louis, the intake and assessment team can be reached by calling 314-587-4800 or 314-244-8800. If you have any questions, please contact us. We'd love to help you.